So look at some characteristic things that you could actually pick up on patients. That's when you do some one or two physical observations, you could see things like a prominent forehead, you could see things like flat nasal bridge, you could see things like wide set eyes, a whole lot of things, So let's quickly look at them and the conditions they are related to, associated with, So prominent forehead is also known as frontal bossing. Okay, it's also known as frontal bossing. This is a nasal bridge that we're talking about that is flat. Then wide set eyes just simply means your eyes, the distance between them is too far. So all of them, you should know that it just describes some facial features that are not normal. So if you say there's a prominent forehead, that's frontal bossing, So it can simply be a normal variation in skull shape, but in medical genetics, it sometimes refers to as frontal bossing. This may be seen in conditions that affect bone growth and development. So flat nasal bridge now, this is it. It's just a lower or less pronounced nasal bridge. So it's common in many populations. It can be associated with some other syndromes and also developmental issues. So how about the wide set eyes? It's also known as Hypertelorism or Hypertelorism rather. Okay, Hypertelorism. So it refers to an increased distance between the eyes. It can always be associated with some additional issues. Okay, so most of the times if we check that particular patient, they have other issues too. So they call that a syndrome, where you have like a disease condition having so many issues together. So you should know that for them, they did not actually make a diagnosis alone. Okay, you always combine it with other things like clinical findings, medical history, developmental history, genetic testings, just for you to make an overall diagnosis. Okay, then funnily enough, some people can actually have this naturally. Okay, so that's what we got.